Let's talk about the swelling. And swelling is not just an aesthetic problem. If you have swelling, especially in your lower extremities, the problem probably is much worse than you think. It is not just too much water. Swelling is often a warning sign that your circulation, heart, blood vessels, or metabolism are under stress. And very often people only try to remove the swelling without understanding why it appeared. After age of 50, swollen legs, ankles, and feet become extremely common, especially in the woman. And many people are told this is normal aging. It is not. In many cases, swelling is a vitamin deficiency problem, not just a fluid problem, and there is one vitamin that plays a central role. Please just stay with me. As I said it, peripheral edema, or swelling in your lower extremities, in the most cases is the problem, especially with your heart, especially with your lungs, especially with your venous insufficiency, and much more serious stuff. The real problem what peripheral edema is, more than half of our body weight is water. That water must constantly move into right direction. And where circulation slows, when blood vessels leak, or when the heart cannot pump efficiently, fluid escapes into tissues. This causes heaviness, tight skin, pressure, pain, and swelling, especially in the legs. Gravity makes it worse. That is why swelling is always stronger in the lower body. Now here's the important point. Not all swelling are the same. Pitting edema usually comes from fluid retention, poor circulation, sodium excess, or inactivity. And non-pitting edema is often linked to heart, kidney, liver, or lymphatic problems and must be taken seriously. And in many patients I see one repeated mistake. They treat swelling only with the pills. I work with the patients couple of decades that have all those swelling problems. You have problems with your heart, with your lungs, with your peripheral edema, or whatever the problem is. You only take chemical medications and you only make it worse each day, because the only way how you can remove all the swelling is to find real cause of swelling and treat them on the safe, natural way. And no one thinks about vitamin. Of course, my dear viewers, what vitamins really can do for us, really. And one of the main reasons why you have edema is going to be chronic deficiency in one vitamin. And it is B vitamin or thiamine. If we talk about most important vitamin for swelling, especially leg swelling, that vitamin is vitamin B1, also called thiamine. Vitamin B1 is water-soluble vitamin, and your body does not store it well, which means deficiency can develop quietly. And vitamin B1 is essential for proper heart muscle functions, energy production, nerve signaling, and normal fluid balance. When B1 is low, the heart becomes weaker and less efficient. When the heart cannot pump properly, your blood stagnates. And when blood stagnates, fluid leaks into tissues. This is why heart-related swelling is strongly linked with vitamin B1 deficiency. And one of the most serious reasons why you have the swelling in your lower extremities is going to be heart problem. High blood pressure, risk of developing blood clots, your circulation does not work properly, of course, especially in the lower legs. And this is where the vitamin B1 play a crucial role. And of course, there is one disease that is completely 100% reason that the people have them. It's called beriberi. If you have beriberi, you have the swelling in your lower edema. It's 100% B1 vitamin deficiency. Recommended dose and how to take it. Vitamin B1 works best as a part of B complex because B vitamins support each other. Typical supportive doses is vitamin B1 25 to 50 milligrams daily and B complex once daily with the food. Vitamin B1 is very safe. It is absorbed easily and excess amount are excreted in urine. People at higher risk of deficiency include older adults, people under chronic stress, people using diuretics, alcohol consumption, and a poor diet. As I said, unfortunately, in today's modern world, we eat those garbage, ultra-processed food each day. We don't take any good quality minerals and vitamins, and this is especially important, my dear viewers, if you are after 50 years and older. Even if you are maybe 55, 60 or 50 or whatever, even if you try take good quality food or take good quality supplements, usually your body cannot absorb it good quality amount, and you must take this approach a lot serious than maybe before the 50 years. But my dear viewers, this is the information about B vitamins in the supplements. For the second thing is also very important is the B food that have in large quantities vitamin B1. Please write this list down. 20 food rich in vitamin B1 is nutritional yeast, sunflower seeds, sesame seeds, flax seeds, macadamia nuts, pine nuts, pistachios, hazelnuts, whole oats, brown rice, whole wheat, barley, lentils, black beans, navy beans, green peas, chickpeas, kidney beans, pork, and the trout. You can blend those food across the week, and regular intake is more important than large amount at once. And vitamin B1 deficiency develops slowly, but its effect accumulate over time. And in most cases, your problem with swelling comes probably a couple years before you don't even realize it, and you take totally, completely wrong approach to your health, and that's why you have swelling in your body, especially in your lower extremities. Remember, vitamin B1 is so important, but I'm going to give you two more information about two other vitamins that works perfectly together with vitamin B1, and they really can protect you in the safe and natural way and help you remove excessive fluid from your body. Bonus support vitamins is vitamin C. Vitamin C strengthens blood vessels and reduces inflammation. And healthy vessels walls leak less fluid. Typical dose is going to be minimum 1000 to 2000 milligram in chronic peripheral edema. Rich sources include citrus fruits, kiwi, peppers, strawberries, broccoli, and spinach. And second important information is going to be vitamin D. Vitamin D supports vascular tone, immune balance, and the heart function. Sun exposure is ideal 30 to 45 minutes daily. If it's not possible, minimum 2000 international daily units from supplements, and you must adjust individually. And I'm going to give you a couple of more information. If you did remember vitamin B1, vitamin C, vitamin D, you really must take them with the food or unbelievably good quality supplements. This is the only way how you can get better. But I'm going to give you a couple more information that you never heard about it. It's going to be what exactly chemical medication that you take in each day for those fluid retention does in your body. What modern medicine usually does when swelling appears, modern medicine usually focuses on removing the fluid. And doctors often prescribe diuretics such as furosemide or Lasix. Those drugs force the kidney to remove water from the body. As a result, swelling decreases quickly, and the patients often feel relieved at first. But here is the core problem. Diuretics do not improve circulation. They do not strengthen the heart muscle, and they do not repair leaking blood vessels. Instead, long-term use often leads to mineral depletion, especially potassium and magnesium. And very importantly, diuretics frequently worsen B vitamin deficiency, which further weakens heart energy and circulation. And over time, the body becomes less efficient in managing fluid on its own. Fatigue increases, muscle cramps appear, and swelling slowly returns, sometimes even worse than before. So the treatment removes water, but the cause remains untouched. This is why swelling becomes a chronic problem instead of resolving problem. And I'm going to give you two scenarios that I see for the last 26 years working in my office. And scenario one is going to be that you only rely on your chemical medication for removing, like diuretics, for removing fluid retention from your body, and you do not take any good care of your health on healthy way, do not take any kind of minerals, vitamins, or whatever, what is going to happen in 12 months? And my second scenario is going to be what is going to happen to your swelling if you follow MarioLab protocols of nutritional and natural remedies, in my experience working with the patients. 12-month scenario, only chemical drugs, no nutrition, no lifestyle changes. At the beginning, swelling usually decreases, the number looks better, and shoes feel looser. Patients feel temporary relief. Because the symptoms improve, many people believe the problem is solved. But after several months, the situation slowly changes. Fatigue increases because the body is losing minerals and energy. Muscle cramps appear, especially at night, due to electrolyte imbalance. Circulation becomes weaker, particularly in the legs. And dependence on the medication grows because swelling returns when the doses are missed. And what is missing in this approach is critical. This is no nutritional correction to support blood vessels or the heart function. There is no guidance on natural remedies that supports fluid balance safely, and there is no correction of vitamins and minerals deficiency, especially B1, magnesium and potassium. And there is no change in daily habits, movement, hydration or sodium balance. So the root problem remains untouched. Over time, swelling becomes chronic, the body compensates less and less, and the heart and the blood vessels become weaker instead stronger. If you find yourself in those information, please, my dear viewers, comment below the video. If you take each day diuretics or similar kind of medication, and your swelling is often appear again and again, and each month is worse, each year is worse, and you are in this position that you are stuck, you don't know what to do next. But I'm going to give you, in my experience, when we work with the patient, what exactly does nutrition, natural remedies, and healthy lifestyle in the 12 months. 12-month scenario with MarioLab nutrition, natural remedies, and lifestyle protocols. This is based on 26 years of MarioLab clinical experience. When we apply structured MarioLab program, the approach is completely different. We do not chase fluid, we restore balance. From very beginning, patients receive clear personal guidance on nutrition that supports circulation, heart function, and the blood vessels integrity. And sodium intake is corrected, not eliminated blindly. And protein intake is optimized to support fluid stability inside blood vessels. Hydration is adjusted so fluid move, not stagnate. At the same time, we correct key deficiency, especially vitamin B1 for the heart energy and fluid movement, magnesium and potassium for muscle, vessel tone and the circulation, and vitamin C for vessel strength, and vitamin D for vascular and immune balance. Natural remedies are introduced carefully and safely, not randomly. They support kidney functions, lymphatic drainage and microcirculation when exhausting the body. And in this approach, we take seriously all problems that you already have. Probably you already have high blood pressure, maybe you have liver problem, maybe you have kidney problem, maybe you have venous circulation problem, and we try to resolve that in the safe and natural way with our experience in natural remedies and nutrition. Lifestyle habits are a crucial part of the process. Daily movements are adapted to the patient's capacity, and the calf muscles activation improves venous return. Sitting patterns are corrected, sleep quality improves, which directly affects fluid balance and the stress hormones. And over months, we usually see different trajectory. Swelling gradually decreases and becomes less frequent. Legs feel lighter by the end of the day, and energy improves instead of declining. Muscle cramps reduce or disappear, and confidence in the body slowly returns. Most importantly, the body becomes stronger, not dependent, and this is not overnight change. It is progressive stabilization of the system that we have previously ignored, and this is the only way how you can get better. If chemical medication works, all of this that I said to you right now, we don't need it, right? This is 1000% wrong. If chemical medication works, I will be giving to my patient each day and the problem will be solved like this. But unfortunately, we see all around the world, every chronic disease is more and more high each year. If we see, I don't know, like 20, 30 years before, people that have heart problems, lung problems, liver problems, swelling, right now it's like a couple of 100,000% more. And this is core root, because we don't think about it, our doctors don't tell us about this anything, and this is we are here where we are right now. If you watching me right now, if you are any country in the world, you can call to my office and I'll be gladly giving you information how you can stay healthy and remove those problems in the safe, natural way. And one more information at the end of the show. If you are searching the best supplements that we use in our office to remove swelling, based 100% organic supplements, vitamins, minerals, and similar kind of supplements, you can call my office and we will give you exactly what is the best supplements in the world that we use in our practice, and it that really can help you remove those swelling, especially minerals and vitamins. A lot of you don't have 0.1% information about good quality supplements, and you buy it just like this. As I said in today's video, vitamin B1, vitamin C, vitamin D, but if you only take first supplements that you buy, you will be 99% wrong. There's only probably like 1% company in the world that produce good quality supplements. We use them. If you want to know what we are using that really can help you, how you can buy them, call my office. My dear viewers, thank you for following me. See you in the next video. Bye bye. My name is Mario. I am European medical professional with over 26 years clinical experience working with the patient all around the world. My core expertise include nutrition, natural medicine, physical therapy, and rehabilitation. Through my MarioLab natural healing programs, I have helped thousands of people every year improve their health, regain mobility, reduce chronic pain and chronic diseases, and restore their quality of life. And those programs may help you as well. If you would like to visit my clinic in person, or if you prefer my personal phone consultations without traveling, my team and I are here to help you. Contact us via Viber or the WhatsApp at the phone number +385 98 9179 200. Your health deserves serious, professional, and individual approach. Thank you for following me. See you next time.